What is Bell's palsy? If this is the question that's running inside your mind, then this video is for you. Friends, Bell's palsy is one of the conditions that mentally, physically and emotionally impacts the quality of life of an individual. Because the condition happens so suddenly that it's absolutely unexpected for an individual to get something like this. And when it happens, the person is absolutely clueless. That's when they start trying to understand what exactly is this condition and why did they suffer from it. So this video is going to explain you about this condition in very simple terms. So make sure to watch this video till the end. Let's begin. Friends, Bell's palsy is an unexpected episode of partial or else one-sided facial paralysis or weakness of one side of the facial muscles. It usually happens suddenly and gets worse within 48 hours. This particular condition happens due to damage to the 7th cranial nerve, also called as facial nerve, which is responsible for your facial expressions. At the same time, the taste sensation in the first third of your tongue, to an extent your hearing sensation, your salivation and tears. Patient experiences pain, discomfort and limited ability to use the facial muscles when they experience Bell's palsy. The problem here is it can happen to anyone at any age at any time. Most often it occurs in women who are pregnant, in people who have got diabetes, influenza, cold or viral infection of some sort. Even people who have got upper respiratory tract infection are likely to develop Bell's palsy. The recovery of Bell's palsy usually begins within 2 weeks and can last up to 3 or up to 6 months. 95% of people recover from Bell's palsy, 100% without any residuals. Only 5% are the ones that are left with residuals who find delays or difficulty in recovery from this condition. Some of the known causes of Bell's palsy are following. Number 1, diabetes mellitus. Number 2, high blood pressure. Number 3, toxin exposure. Number 4, Lyme disease. Number 5, Guillain-Barré syndrome. Number 6, sarcoidosis. Number 7, nerve inflammation following a viral infection. The symptom that a person with Bell's palsy experience will be following. 1, distorted or else limited facial movements, especially your facial expressions. 2, headaches. 3, facial pain. 4, tearing from your eyes. 5, drooling or difficulty holding water or food inside the mouth. Number 6, loss of taste sensation from the front 2/3 of your tongue. Number 7, sensitivity to the noise. And number 8, difficulty or inability to completely close the eyes. The diagnosis of this condition is done with the help of ruling out the other condition that can lead to facial paralysis. Some of the key diagnostic procedures that are done are nerve conduction velocity test, electromyography test, CT scan, MRI, blood test. The treatment for this condition lies in the medication which has to be taken in the first 72 hours. Steroid medication plays a very critical role in reducing the inflammation that is developed on the facial nerve. Apart from that, antiviral medication, analgesic, physical therapy, acupuncture, relaxation practices, biofeedback and supplementation are the key methods of treatment for Bell's palsy. There are some complications that are associated with this condition. The most devastating complication of Bell's palsy is synkinesis. Apart from that, eye infection, facial pain, balance challenges and tinnitus are some of the few other complications that are associated with Bell's palsy. The key things to remember when you are trying to understand about Bell's palsy is this. Number 1, Bell's palsy is a temporary paralysis. Majority of them recover from it completely. You need to be patient and consistent with your rehabilitation or recovery tools. It might take somewhere around 90 days to 6 months for you to see a 100% recovery from Bell's palsy. If you observe some unnecessary movements developing on your face in the later stages of Bell's palsy, it's important to see a physical therapist because you might be at a risk of developing synkinesis. This condition is caused by inflammation of the facial nerve. Hence, the key treatment lies here is reducing the inflammation levels from your body. The symptoms of facial weakness or facial paralysis will get worse in the initial few days and will start getting improved after 2 weeks. So be patient. You might observe that some movements will come faster, some movement take more time to recover. It all depends on which branch of the nerve is taking little longer than usual to recover. Medication, eye care and rehabilitation are very important and unignorable aspect of Bell's palsy recovery. So make sure to take right therapy from right professionals for your Bell's palsy. On that note, we'll end this video here and I'll see you in another video. Thank you.